Greetings, friends! Today we're diving deep into a topic that affects, arguably, every second person over the age of 45. We're talking about dizziness, unexplained unsteadiness while walking, and sudden weakness that leaves us drained even for simple tasks. And what do we usually do? We rush to doctors, search for frightening diagnoses, and swallow handfuls of pills. But what if I told you that the answer to this mystery, this mass affliction, is much simpler than it seems? I'm going to share with you one simple rule that turned the conventional wisdom about drinking water upside down and helps fight dizziness better than any pills. Today, we'll explore how improper water consumption can literally knock the ground from under your feet, and how learning this simple secret can bring back your lightness and confidence. Get ready to be surprised, because some of what you'll learn here contradicts common beliefs. Water, elixir of life or a delayed action poison, the hydration paradox. Our body is a true water world. About 60–70% of it is made up of water. It's not just a liquid, it's a solvent, a transport system, a thermal regulator, a shock absorber. Every biochemical reaction in our body occurs in a water-based environment. From energy production to brain function, from joint flexibility to the sparkle in your eyes, it all depends on water. But here's the paradox. Despite its critical importance, we often treat water carelessly. We drink it only when we're already dried out, or on the flip side, we guzzle liters trying to be healthy. Both extremes can be harmful. When there's not enough water, chronic dehydration. Imagine, your blood needs to deliver oxygen and nutrients to every cell. If there's not enough water, the blood thickens, like sour cream. The heart has to work over time to pump this jelly through narrowed and, with age, less elastic blood vessels. This leads to blood pressure spikes, one of the most common causes of dizziness. The body tries to compensate for a lack of fluid volume. Reduced brain circulation. The brain depends most on a constant blood supply. Lack of water lowers this flow, leading to foggy thinking, headaches, memory problems, and yes, dizziness, malfunction of the balance system. This complex system in the inner ear is extremely sensitive to blood flow. A water deficit leads to oxygen starvation in its cells, which start sending distorted signals to the brain, causing instability and vertigo. When there's too much water, or it's consumed improperly, overhydration or rapid intake, you might think, the more, the better? Not at all. Rapid, large amounts of water, especially on an empty stomach or after dehydration, can cause water intoxication, hyponatremia, a dangerous condition where blood sodium levels drop sharply due to dilution. Symptoms include nausea, vomiting, headaches, seizures, brain swelling, and, again, severe dizziness. While more common in marathon runners who drink too much water without electrolytes, milder forms can affect anyone with poor hydration habits. Sudden stress on the body. A large volume of fluid suddenly enters the bloodstream. The heart must instantly pump more blood, and the kidneys go into overdrive to remove the excess. This can cause swelling and destabilize the cardiovascular system. See? Both deficiency and excess, along with poor drinking habits, can be the root of problems we often mistakenly attribute to other causes. Balance system and blood vessels. The hidden victims of improper hydration. Let's dive into the mechanics. Our balance system is incredibly complex, yet very delicate. It consists of 3 semicircular canals and 2 otolithic organs, all filled with a fluid called endolymph. When we move our head, this fluid shifts, and tiny hair cells send signals to the brain about our body's position in space. Research shows that any change in the body's water-salt balance directly affects the composition and volume of endolymph. With dehydration, endolymph thickens and flows poorly, distorting the signals sent to the brain. With overhydration or rapid water intake, its volume can temporarily increase, putting pressure on the hair cells. Both of these states are imbalances, and both lead to dizziness, unsteadiness, and swaying. It's no surprise that these symptoms resemble vestibular disorders like Meniere's disease, where excess endolymph is also a key issue. Blood vessels, our vital highways as we age, especially after 45. Blood vessel walls become less elastic and may accumulate cholesterol plaques. Proper hydration is like regular cleaning and lubrication for these highways. Water helps keep blood fluid, which reduces strain on the heart and lowers the risk of blood clots. Most importantly, it ensures a steady supply of oxygen and nutrients to all organs, including the brain and balance system. A water deficit can cause blood vessel spasms, while adequate intake helps them gently dilate, which is vital for maintaining normal blood pressure and preventing dizziness, not just dizziness. Other masks of dehydration. After 45 friends, we've already seen how critically important water is for our balance. But what if I told you the list of ailments we often blame on aging, but are actually related to how we drink water, is much longer? Let's look at some more common complaints that may signal hidden dehydration. Complaint: I wake up with a headache almost every day, like I've been unloading freight cars all night. Question: what if the cause isn't mythical intracranial pressure or magnetic storms? Common complaints that might be caused by dehydration and how to fix them with water. Complaint: I wake up with a headache every morning. Explanation: during 6-8 hours of sleep, we lose 0.5 to 1 liter of water through breathing and skin, even without sweating. The brain, made of 75–80% water, slightly shrinks with dehydration, pulling on membranes and blood vessels, causing headaches. Tip: drink a few sips of water before bed and 200 to 300 ml a glass right after waking up. Your brain will thank you. Complaint: my memory is getting worse, I can't focus, my head feels foggy. Explanation: even mild dehydration, 1 to 2% of body weight, slows nerve signals and the production of neurotransmitters, reducing focus, memory, and mental speed. Tip: consistent hydration clears mental fog and supports brain function. Complaint: my legs feel heavy at night and I get cramps. Explanation: dehydration causes loss of minerals, magnesium, potassium, sodium, vital for muscle function. Thicker blood and poor circulation also contribute to cramps and heaviness. Tip: drink water regularly and eat magnesium and potassium-rich foods like bananas, dried apricots, nuts, greens. Complaint: my lower back hurts, especially in the morning. Explanation: spinal discs are 80% water. They act like cushions. Chronic dehydration causes them to flatten, compressing nerves and causing pain. Tip: stay hydrated to keep your spine flexible and pain-free. Complaint: my eyes feel dry and blurry, especially by evening. Explanation: tear fluid is mostly water. Dehydration reduces tear production, causing dry eyes, irritation, and even blurry vision. Tip: drink enough water daily to protect your eyes and maintain visual clarity. Complaint: I'm constantly bloated and constipated. Explanation: water helps form soft stool and supports smooth intestinal movement. Dehydration hardens stool and slows digestion. Tip: adequate hydration acts like oil for your digestive system, ensuring regularity and comfort. How proper hydration can solve age-related health issues. Frequent colds and slow recovery. Dehydration slows down the lymphatic system, which is crucial for immunity. Thick lymph and dry mucous membranes make it easier for viruses to invade. Solution: drink enough clean water to keep your immune highways clear and defenses strong. Trouble sleeping, constant anxiety, even mild dehydration triggers stress. Responses: raising cortisol levels and lowering melatonin, the sleep hormone. This disrupts sleep and increases irritability. Solution: stay hydrated throughout the day and sip a bit of water before bed, not too much. The 3-sip rule. A smarter way to drink water. Forget 2 liters a day. It's not about quantity, but quality. The 3-sip rule means drinking water slowly, 3 small sips at a time, throughout the day. Why it works. Gentle absorption, no stress on kidneys or heart. Water is absorbed more efficiently. Stabilizes balance system. Prevents dizziness by supporting. Inner ear fluid balance, better cellular hydration. Activates aquaporins, water channels, for optimal absorption. Promotes mindfulness. Trains you to listen to your body's real hydration needs. Real benefits. You'll notice morning headaches disappear, clearer thoughts and better memory, less dizziness and better balance, fewer muscle cramps and lighter legs, improved sleep and calmer, mood, less joint pain, healthier skin, nails and hair, better digestion, fewer bloating and constipation issues, fewer colds, stronger immune response. How to start morning 3 sips after waking up throughout the day. Keep a small bottle with you. Take 3 sips every 1 to 1.5 hours before meals, 3 sips 20 to 30 minutes before eating. Before bed, 3 sips an hour before sleep. Consult a doctor if you have kidney, heart issues, or take medications affecting hydration. Many health issues we blame on age can simply be signs of poor hydration. The 3-sip rule is an easy, science-backed habit that can bring surprising results. Try it and feel the difference. ChatGPT Skazal, share your experience in the comments. It will be valuable for all of us. And of course, if you found this video helpful, give it a like and subscribe to the channel so you don't miss more useful tips.